Hello viewers, thank you so much for joining me on this channel. In today's video, we will talk about breaking bad news. This is the second installment of the newly started Practice with Puspen session. In today's video, Dr. Pritha Ghosh will graciously join us to practice breaking bad news. Breaking bad news is one of the most commonly encountered communication skills stations in MRCS ENT OSCE. Basically, it assesses how professionally a doctor can disclose bad news to a patient or their carer. So without further ado, let's get into the substance of this video. If I am being perfectly honest, I have to tell you that I received no formal instruction regarding how to break bad news during my training in India. However, with the advent of new regulations introduced by National Medical Council, how to break bad news is something even MBBS students should know and they are assessed on. Certainly in MRCS ENT OSCE, breaking bad news is a very frequently encountered communication skill station. There is a technique that one can employ to successfully pass MRCS ENT OSCE. It just requires a little bit of practice. This technique that I'm about to tell you will help you pass MRCS ENT OSCE. It might also help you in other OSCE pattern exams, including 8 COM stations, that is attitude, ethics, communication stations in MBBS exams as per the new regulations introduced by National Medical Council. It can also help you in your day-to-day life as a doctor because unfortunately it is a part of the work life of a doctor that we sometimes have to disclose bad news to patients or their relatives. It is very important to understand at the very beginning that the only bad news is not cancer. Cancer isn't the only bad news. You have to be able to think beyond cancer when it comes to breaking bad news. Other news can be quite devastating as well, such as the situation we will discuss in this video. In a previous video on breaking bad news, I had mentioned that the correct way to approach breaking bad news stations is the mnemonic spikes: setting, perception, invitation, knowledge, empathy, and summary. Summary also includes providing a structured plan of management going forwards. I will not describe each of these words in detail here. For that, please check out the video Breaking Bad News. I leave a link to it in the description below. In today's video, I will talk about a particular scenario with Dr. Pritha Ghosh, who has graciously agreed to practice with me. A very important aspect of passing MRCS ENT OSCE is finding a reliable practice partner to practice communication skills with. If you don't practice communication skills, there is a good chance that you will not do as well as you want to in MRCS ENT OSCE. If you want to practice with me, please feel free to reach out in the comment section below. I'll be more than happy to practice with you and provide the feedback based on my experience of passing MRCS ENT OSCE in the first attempt in May 2023. So without further delay, let's welcome Dr. Pritha Ghosh and let's discuss breaking bad news with the help of an example.
Hello, Dr. Pritha Ghosh. Dr. Pritha Ghosh
Hello.
and I worked for 2 years in a government medical college many years back. She is going to appear in MRCS ENT OSCE in the near future. So she has sportingly agreed to practice with me. In this scenario, I will play the role of the son of the patient. This is a breaking bad news scenario. I will play the role of the son of the patient and she will play the role of the doctor. Hopefully, this will help you get an idea regarding how you should prepare for MRCS ENT OSCE communication skills stations. So, Dr. Pritha Ghosh, whenever you're ready, I'll start the timer for 7 minutes. Are you ready?
Yes, I'm ready.
So, your time starts now.
Hello, I'm Dr. Pritha Ghosh and I work as an ENT surgeon in this hospital. May I talk to you for a few minutes?
Yes, tell me, doctor.
I understand that you are the son of a patient that has been admitted with us. Could you please confirm his name and date of birth for me?
Yes, so my father, his name is Tom Anderson, and he is 50 years old.
Okay. And how do I address you, sir?
You can call me Sam.
Okay. So, Sam, could you please tell me what do you know about your father's condition?
Yes, so I'm a little concerned because he had a little bit of bleeding from his nose. So I rushed him to the accident and emergency. And ever since I'm not aware of what's going on. I've been waiting for 4 hours and nobody has told me what's going on. So I'm beginning to worry now.
I'm so sorry that nobody has contacted you for 4 hours, and I apologize on the behalf of the hospital. And I understand that this has been causing a lot of worry to you. Uh, could you please tell me more about your father's condition?
Um, so he was fine this morning when he suddenly said that he is bleeding a bit from his nose. A few years back, he underwent a heart surgery, and that was fine. The heart surgeon prescribed a drug. I don't remember the name. He has been taking that drug every day. Um, and he was fine, so that's all I know.
Okay. Your father had a heart replacement heart valve replacement, and
Yes.
he has been taking a drug ever since. Um, are you comfortably seated? And do you have anyone else with you?
No, I'm alone. And yes, this is fine. Thank you for asking.
Okay. Okay. And would you like to invite somebody else?
I'm just here by myself. There's no one else.
Okay. Okay. Is it okay if I invite the staff nurse with me?
Yeah, that's fine.
And I've given away my phone to my assistant so we would not be interrupted during our discussion. So, as you know that your father had a bleeding from his nose, and we actually initially we tried to give him some medications and stop the bleeding by pinching his nose, but the bleeding did not stop. So we did an endoscopy, and we tried to locate the bleeding point, but there was no bleeding point as such. It was bleeding all over.
Mm.
So we had to apply dressing in his nose, which are known as packs, to prevent the bleeding. And I'm afraid to say that he is still bleeding a lot, and he is in a condition known as hypovolemic shock, which occurs because of excessive bleeding in the body.
So you're saying it's very serious?
I'm afraid I do not have the news that you were expecting, but unfortunately, yes, he is bleeding a lot, and the only option left with us right now is to take him into surgery to stop the bleeding.
But I rushed him to the hospital as soon as I could, and he wasn't bleeding this much at home. What happened?
Uh, I know that this is causing a lot of worry to you and you are shocked, but actually, as you know, he has been taking this medication, which is most probably which is given for any heart surgery, post heart surgery, to thin the blood. Do you have any idea about it?
Yes, yes, the heart surgeon said that this would thin the blood. Are you saying this
Yes.
medicine caused this?
Yes, most likely it is because of the medicine, but it is essential for all the patients who have undergone any kind of heart surgery. So even the medicine is essential. But unfortunately, yes, most probably the medicine is the most likely cause for this bleeding.
So, how will you stop the bleeding?
We will be taking the patient into the surgery. We'll be taking your father, and we will actually try to locate the bleeding point and stop the bleeding. But I'm sorry to say that he has been losing a lot of blood, and his body might not be able to take the stress of the surgery.
I'm not sure I understand. Are you saying he's not going to make it?
I'm sorry, I know you're shocked, and this is causing a lot of attention, but he might not make it. But we cannot give up, Sam. This is the only option left with us to try and stop the bleeding, which might actually help us save his life.
But you're saying the surgery will be too much for him. Why can't you try something else?
I'm sorry to say, but we have tried everything else that was possible, and this is the only last option left for us to do.
So do I have a choice? Can I say no to the surgery?
I'm afraid, but that is not the option we have, Sam.
So you're just going to do the surgery anyway?
That is the only option that we have, but could you please wait here, and someone from my team will get back to you?
Could you tell, my sister just called me, she'll be on the way. Could you explain the same thing to my sister?
Yes. We could definitely do that, and we would be happy to do that.
Okay, that's the time. So this was a very good performance. Thank you for participating in this.
Thank you. Hello.
Thank you so much for watching. I hope you like this format. If you want to practice with me, you can reach out to me in the comment section below. It is not mandatory that every practice session with me will be recorded and uploaded on YouTube. I will not do so without your consent. But if you are looking out for a reliable practice partner with whom you want to practice communication skills in terms of MRCS ENT OSCE, then feel free to reach out to me in the comment section below. I'll be more than happy to practice with you. Thank you for watching once again. Take care, and I hope I'll get to see you in the next video very soon. Bye bye.